Hello, everyone, and welcome to the latest edition of Women in Healthcare podcast with Medical Group Management Association. My name is Adrienne Lloyd, and it is my honor today to have with us Dr. Jenny Reese, who is a professor and section head of pediatric hospital medicine at the University of Colorado, and is also the vice chair for faculty wellbeing for the Department of Pediatrics, and also an assistant dean of faculty wellbeing. So we're excited to have her with us today to share. And Jenny, I'd love to just hear and share a little bit more about your career and kind of what made you choose pediatric hospital medicine as a specialty and just your journey along the way.
Yes, thank you. It's fun to be here. I appreciate the invitation. Well, when I finished my residency in pediatrics, pediatric hospital medicine was not yet a known specialty. So I've really had the great fortune over my career of building our own program as the specialty evolved. So my first job out of residency was as working in urgent care and as a general pediatrician in the emergency setting. And then about 3 to 4 years into that role, our hospital and our Department of Pediatrics started some hospitalist programs, first at community hospitals, and then here at our big Children's Hospital Colorado main Anschutz campus. So I got to evolve my own career as the specialty has evolved as well.
That's awesome. That's awesome. Well, tell us a little bit. I know you've got the multiple roles kind of focusing on faculty well-being. What really has kind of what drew you to kind of stepping into those positions, and what have you enjoyed? Or maybe is there anything that surprised you as you've been in those roles?
I mean, we all have our own personal story on top of our career story. And I think that the reason I got sort of drawn into working around well-being was at some point it emerged for me as a calling, a pretty clear calling around wanting to, heal the healer or provide care for the caregiver. And that stemmed from having some of my own very personal challenges after, within the first 5 to 7 years in my career. Work was going really well. I was getting promoted. I was thriving. But in my personal life, I was having some challenges, including some mental health challenges. And I had 2 babies 15 months apart. And so juggling being a mom and a wife and advancing in my career, but also having my own personal struggles that I felt really alone in how I was dealing with those, because on the surface, everything looked rosy. And so kind of coming out the other side, getting into therapy, getting, in a better place in my life, I realized it shouldn't be that hard for people like me working in healthcare, having successful professional careers, but having personal struggles. I think the first sort of messaging for me or realization was it shouldn't be that hard, and we should have better systems in place to support the people around us and in the work that we do.
No, I love I love and obviously don't like the word alone, but I think that resonates with so many of us, because I think it's very easy. And I expect, as a healthcare leader, I definitely had many, many moments feeling alone in terms of trying to figure out, really how to navigate the situation. And I can imagine as a female physician, there's different elements to that too, and it feels there's tends to be kind of I think this is the walls have broken down a little bit, depending on the organization, but a lot of nervousness and, just anxiety around coming forward and saying, like, I'm struggling with X, Y, or Z. And, really feeling like that could be something that kind of is almost like a scarlet letter, if you will. It kind of carries through your career. And like, how have you, what strategies have you guys kind of implemented to really help just open the conversations, I think, just to really create a platform where people can feel more at ease and comfortable to say, I need some help in this area. And have you found? What stories have you heard, or like what's been working?
Yeah, I mean, I think there's fortunately been a great movement to destigmatize mental health across our society, not just among people working in healthcare. So that's helped. But I still think folks working in healthcare, physicians, APPs, nurses, we all feel like, in a way, the rules don't apply to us. We're the worst patients.
We're not be able to figure it out. Yeah.
We're not supposed to have any needs. So I think just destigmatizing. there's been a lot of movement around well-being in healthcare. Burnout is being talked about. It started, being published probably in the mid to late 90s, and it became more and more of a topic that people were talking about. And I want to clarify, burnout is not a mental health diagnosis, and it's very different
Right.
from things like
Yeah.
depression and anxiety disorder, but
Sure.
sometimes there's, overlap. And so just the idea that there are people talking about it and saying it's okay to need help, and let's put some systems in place to offer help. And uh, uh, one of my favorite stories to tell around this journey was my boss, who was our chief medical officer at the time, who's really been a wonderful mentor to a lot of people. Her name's Joan Bothner. There was a situation that had happened at our institution around a physician who was struggling. And Joan said to me, well, Jenny, you go to yoga retreats. Why don't you start a faculty wellness program for the hospital? And I said, just for children's or the campus? And she said, write a proposal for the whole campus. And that kind of got me started. It took a good, 2 to 3 years before things really started taking hold. But that sort of supported and inspired me to just go around and start having conversations with people and saying, this is important work. This is work I want to do. Here's how I'd like to do it. Where can this fit? And is this important? And so I think also just having conversations with leaders and influencers who could really support the work was important as well. And that's how it's kind of, I think, led for me to get to be where I am now.
No, I love that. And I know that's kind of morphed into really a full like mentorship program, and even broader than just mentorship. Like, what are some of the elements that you guys have found successful? So hopefully others can
Yeah.
kind of
I
take
mean,
some.
when you think about the model of well-being, there's different published models in the literature, but really they sort of call on the fact that we have our own individual well-being practices, that we have our system and our culture around how do we think and talk about it and support it. And then we have our system efficiencies. And
Yeah.
if you think about the things that kind of drive you crazy in working in healthcare, we have to address those things. So that's just sort of, is it the electronic health record? Is it, the way a clinic runs, whether it's, people working at top of scope or not? And then there's, as you were sort of leading with, what is the culture? Do people support each other? Are people able to talk about their challenges and ask for help and get the help they need? And then the part I think that's the hardest is this concept around individual well-being, because hot on the heels of all the talk about burnout and well-being were, interventions being offered like meditation, yoga, wellness, work-life balance, all these things that are great and nice. But when you come into in front of a group of folks who are very busy, very tapped out, don't feel like they have extra time, feel like it's the system around them driving their
Right.
challenges, this suggestion around, oh, go do meditation or yoga doesn't land well.
Yeah.
But it's important. I would say that in the individual practices part is important, and that's where I've been really trying to sort of strike that balance around. Let's look at the things that drive our individual practices around resilience and well-being, because no matter what environment you work in, we've all chosen this calling to say, I'm
Yeah.
walking into the face of other people suffering every day. I need to have my own internal tools to allow me to keep showing up every day while we work on the system drivers and the culture and things like that.
How are you, just, diving into that, how are you having, like, what's been most effective in having these conversations? Are you doing kind of group discussions to really open that? Or are you doing more one-on-one, or what do you really feel is kind of, and I know, again, it's individualized, but are there things that, if somebody's looking at starting a program or expanding kind of what they're doing? Because I agree, I think I hear that from a lot of organizations, like, well, we're adding all these services, right? Like, we've added these options for these yoga classes or meditation classes, and all of those are great for those that want to and feel like they can make the effort. But I do think most of this comes down to that conversation around what does work-life balance, integration, success as a human mean to that person, and how are you kind of getting under the hood of those
Yeah.
things, how people think differently? And
All levels. I mean, I'm extremely fortunate to, at this point in my career, be in a leadership role where I can have a voice. So I'm always the person speaking up about that. And sometimes, I I know people are cringing, or I sort of make a joke of it, like, y'all know what I'm going to say now. So it is that sort of, hey, this is important message across leadership. And you know, my chair, the first conversation I had with him about this topic, I remember, I think his reaction was like, well, if we start talking about burnout, then everybody's going to claim to be burned out. And I thought, okay, we have a ways to go. But he's come a long way, and he's extremely supportive of the work and talks about it a lot, about we need to find our joy in our practice, and we need to look at the literature and figure out how to make a change. But then the other side of it, we developed a curriculum, a well-being curriculum with 4-hour-long modules that really dive into things like the PERMA model of well-being from the study of happiness from Martin Seligman's work, and kind of looking at your sort of wheel of life balance. And then I would say, if I have a sort of soapbox about the individual practices, it's really around, what are your values at your core? What do you deeply value? What gives you meaning and purpose? And where can you find as much as possible overlap with your values in the work that you do?
Right.
And there's a whole lot to dive into there, but you know, no one gets to spend 100% of their day or their time only doing things that are that, you know, deeply connected to their values. But there's a publication from Tate Shanafelt and his colleagues that says, if we spend 20% of our time doing things that are meaningful, that's protective of burnout.
Yeah. No, and I do think, to your point just a moment ago too, about you know, and a lot of my background has been, you know, kind of on the administrative side in the like process improvement zone. And I work with organizations around like really making things work better, both as a team and systems. And I think that is to getting to that like 20% of people feeling like what they're doing is really impactful. And like, this is why I'm here. It's like having those conversations and that work, I think, coupled with well-being discussions, it's part of, you know, how do we reduce those like frustration moments where the EHR click 20 times to get something done and it should take 2, or, you know, how can we utilize our team members in different ways and really navigate like what's really crucial and what would make it easier to do what you and the physicians, to support the physicians in doing what they want to do, which is providing great care to the patient. So have you kind of incorporated like change management initiative conversations into what you're doing as well?
Yeah, absolutely. I mean, I'm really fortunate to work with a whole team within the Department of Pediatrics that's whole focus is around practice optimization. It's led by my one of my colleagues, Liz Jackson, who's admittedly didn't go into being a physician because she couldn't do the blood and guts, but her whole purpose is really wanting to help make the system better for people working in healthcare. So yeah, we get to partner on really diving into what are the drivers, what are the factors around making people's lives better. You know, there was an article published called, using the acronym GROSS, getting rid of the stupid stuff. Like, how do we do that? And so that's been really gratifying. And we've been able to do some small grant funding for faculty to get protected time to do that work, those improvement efforts, and then help support those efforts, and then measure their outcomes, and then share and publish the findings, and then, you know, expand on that work. And I was going to say, when you were talking earlier, you know, that's where the money is, and it's figuratively and literal, right? You can show financial return on investment of improved efficiency, improved satisfaction.
Absolutely. Yeah. And I think I've seen many physicians, but even my own physicians coming to me and being like, I'm so frustrated if things don't get better, I'm leaving, and shifting to like, hey, we've optimized the process, we've optimized it. Like in this case, it was a couple surgeons, we've optimized the patients they're seeing. And so they're able to do more with less. And like, now my personal balance approach is like, well, I'd actually think I can do what I want to do in terms of productivity in 4 days instead of 5 days, and really actually shifting their entire work week. But it took getting into the nitty-gritty of what's not working and having those conversations with the team along the way to really redesign those processes. So I think that's very important. That's good. You guys are doing that. On a personal note, how do you prioritize your own well-being in the midst of kind of all the other jobs you have? And
that's a great question. Yeah, I mean, I at least try to be aware, like, how am I doing? How am I feeling? I notice when I'm feeling frustrated or agitated or irritated. My passion is riding my bike. So in the summer, especially, every chance I get, I'll go outside and ride my bike up mountain passes. That's kind of my perverse sort of personal well-being activity. But really that sense of like going in and doing what I love and taking time away and just really like feeling good about both, physically the benefit that has for my body and psychologically and mentally. But you don't always have that luxury to have the time away. So really having close relationships with people I work with. I very much have my go-tos around me, people that I can call, process, vent if needed, get support, get input, get validation. I think everybody should be able to just list off the top of their mind, who are your top 3 to 5 go-tos. If you don't have them, go find them, seek it out, ask people to be in that role. And then I've had, another favorite reference of mine is the book Drive by Daniel Pink, where he talks about the drivers of intrinsic motivation being autonomy, mastery, and purpose. And I've just also been extremely fortunate in my career to have, and it's not just luck, it's by, some design, a lot of flexibility with my time. So I've been fortunate to have administrative roles where I get a lot of autonomy and an opportunity to then do things that I'm really passionate about. And I think that, people can feel, I think, locked in healthcare, but I think encouraging folks to say, well, where do I have some, sense of agency to spend my time a little differently? What am I going to pursue? What am I going to say yes to? What leadership roles might I want to take on? And I think giving people that agency to say, I get to choose, where I'm putting my time and energy is huge, because that's why I've been doing what I've been doing for so long, is I get to do what I want to do and what I love.
Yeah.
And I do, certainly plenty of things that I don't love. And I take note of that and think, okay, I'm just going to make sure I'm managing that that's not the 80 or 90%, that I try to keep that at the less than, 20%.
Yeah. No, I think it is very important to think about, like, what are those? I always have like a lot of times when I'm working with different groups, we'll do like a what not to do list, and like, what are those things? And then, what are those things that you're doing that really aren't allowing you to be at your top level, whatever that is, like really feeling like you're contributing in the best way. And then, how can you automate, delegate, or eliminate those things, both individually and as a team, I think are good discussions.
Yeah,
So
I
for
made a spreadsheet one time where I just went back through my calendar over 6 months' time and kind of took inventory of all the things I was doing, what I was spending my time on. And then in the spreadsheet, I made a joy ranking column of like 1 to 5.
Yeah.
And that really helped kind of clarify, okay, where do I want to put more effort and where do I want to let go of some things?
Yeah, I love that. And what you mentioned, you've had these administrative roles, but I'm sure there may be, there's always an opportunity, I think, for physicians coming from the administrative perspective. We love having physicians who are passionate about, an aspect of the practice, the academic mission, whatever it is, kind of willing to help us in those capacities. But what advice would you give to someone who's maybe kind of earlier in their career, seeing an area that they're interested in, but just literally feeling like either they don't feel like they're being seen for the opportunity, or they don't feel like they have time, and energy to commit to that, given, maybe it's family or work or other things? Like, what advice or strategy would you recommend for them to think through?
That's a great question. And I'll put on my coaching hat here. I got certified as a coach, and we started a coaching program in our Department of Pediatrics, which is really exciting. So we have 9 faculty members who are coaches, and we're coaching over 60 faculty. So I've gotten to do a lot of that coaching myself. And that, to answer that question, is probably the most common thing people bring to the coaching engagements. Like, exactly, how do I do, what you just posed? And it kind of comes back to what we've talked about. I often start early on with a values clarification exercise, and then a sort of I call it the wheel of life. This is the model, we got from our coaching training program, and just take stock. How would you rank your satisfaction with these different areas? And you can do that sort of just within work. And in academic medicine, you have educational demands, you have scholarship demands, you have clinical demands, and then you might have administrative. So again, it comes back to that, as you said, what do I putting time and energy into that may not be serving any value for me? Got to let go of it. Maybe
Yeah.
I signed up for something 4 years ago because at the time it was going to help me get to my next level in
Right.
promotion, but I can hand that off to somebody else now. So it
Yeah.
really is that time balance. It's not just how can we pile more on our plate. I think
Right.
it really, there's a lot of power in, and we need to talk more about, say, what do I say no to so I can get to yes?
Yeah.
And that just has to come from within. What do I want to do? What do I want to put my energy in? And that doesn't, it's not about like how many hours a week you work. I mean, I have colleagues that happily probably work 80 hours. I'm not going to judge them for that.
Yeah.
It's what are you doing with your time and energy, and do you want to be doing it?
Yeah. I think that's fantastic. I love that you guys are doing a coaching from within. I think that's so beneficial for them to have that resource. And I think the other thing I would add to that is just a thought for people to consider is if they're looking at a role or an opportunity, trying to, it's okay to be creative. Like maybe there's a role that's posted and you're interested in providing input to that, but maybe you don't feel, and this may be something that you guys would go through with them during the coaching conversation. It's like, I don't know that I can commit that much effort to doing that role, or maybe I don't want to do that role alone. I'd be willing to do this piece of it. Is there another physician that might be interested in contributing, and kind of we could co-chair or, whatever the role might be, kind of leading that initiative. I think there's definitely opportunities for that. And I mean, really having that willingness to just, like, again, focusing on what do I really love to do? I want to create, I want to contribute in this area, but I don't know if I can do it in the way that it's framed. How do I really kind of bring that forward? So,
Yeah, yeah,
I think
I love that. We've seen that in my own section. I also am the section head of hospital medicine. So I've had the amazing fortune of building this team from, 5 people back in 2007 or so to now over 120 physicians and APPs and a couple PhD researchers. And yeah, when we create leadership opportunities, we talk as a leadership team about what is the right model, how do we solicit interest, and then a couple times we've had 2 people say, "Oh, we're going to co-lead or
yeah.
do this effort," and it's worked out really well. So I think that's a great strategy.
Good. We didn't talk about this, but I know recruitment for physicians is just a huge challenge for many organizations, particularly in kind of primary care, pediatric, internal medicine specialties. Is this something that you guys are kind of bringing forward during those recruitment discussions and kind of adding this element into faculty that are interested in joining University of Colorado and Peds? Like, are you having any of these discussions? Because I imagine it would be very meaningful to many of them.
Yes, absolutely. I mean, I'm directly sort of more in control of recruiting for our own section, and it's as the section head, it's easy for me to sort of say, well, these are our values, and this is how I lead, and this is our culture. But I always say I go talk to the people in the section, and hopefully they will, you will hear from them. Yes, this is what it feels like to work here. So building a team around a set of values and around a culture that I am very clear with everybody about. And then I think the people within the team have that same embodiment, and those are things like teamwork, camaraderie, collaboration, support, humble expertise. Like it's sort of
Yeah.
and one of my colleagues, after she had her own sort of challenging event, she said, you just have to be a really good person to be part of this section. And that was sort of like, I felt like I could drop the mic and say my work here is done. Like I was so proud to hear that
Yeah.
description of our team. So yeah, I think that culture really can speak to itself, but at a broader, at a department level, there's, 1,400 faculty in our department, and where I get to be involved in, searches and interviews is I certainly talk about the fact that we have a well-being program and that the approaches that we're taking. So having a coaching program and having a robust peer support model in our practice optimization work. Like, yes, I would like to think that for people hearing about our approach and our effort, that is going to be a draw to come here.
Yeah.
Of course, there's a lot of variables, but yeah, it's
Sure.
important. I think I would hope people looking for jobs are asking those questions.
Yeah, I think that's very, very important. And I think you hit on something else too. It's one thing to hear it from the recruitment committee members or the people that are interviewing, but I think for the candidates to really talk to those who are living it every day and for them to be able to echo that back is so crucial. And I do think that's not often the case. So congratulations, I think, for all the work and that you guys have done. And I think it's just really, really important to create that. So hopefully people will be inspired just by hearing what you guys are doing and take some ideas to implement. And so is there anything kind of to wrap up? Is there any one thing that as you think about your journey that you wish you would have known or approached differently as you kind of started in healthcare?
Wow, that's an excellent question. I think it would be, I don't know if it's something I would have known, but like just hoping that we're moving the needle on saying, we're all human. We all have these personal experiences. It's okay to suffer. It's okay to not be perfect. Ask for help from people around you and really just make that the culture versus, people kind of learning the hard way or going through it alone and then being inspired to help make a difference. So
yeah. Just kind of giving yourself more grace and you don't have to do it all by yourself. And it really is about finding those that can support you and open with what you need. I love that. I love that. Well, thank you so much for taking the time to be with us today and to share everything that you guys are doing. I think it's just, again, so fantastic that you guys have put the effort into that. And I know it does take a lot of effort, and it's easy to just really focus on taking care of the patients and moving things through and the operations. And it's easy for all of this work to get lost in just managing the day-to-day. And so it's really, I think, a very big kudos both to your section and what the work you're doing and the organization as a whole that you guys have invested in this. So
thank you. I mean, it's really gratifying. And one of, if not probably my top core value is connecting and helping people. And so I'd love when people reach out and say, how do you do this? Or can you help us? My answer is always yes. And I think that's how we keep getting better. So it's really gratifying, and I'm extremely grateful for, and I feel very fortunate to get to be in an environment where I'm supported to do the work. So it's I appreciate that. Thank you.
That sounds great. Yeah, if you don't mind, we'll share your kind of information. So if people are interested in listening to this and want to reach out and learn more from you, we'd love to share. And again, thank you so much for taking the time to share with us today. And we really appreciate it.
Thank you. My pleasure.